What is akathisia? My name is Dr. Ruth Sutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the concepts that has come up over and over again on my page is that of akathisia, because this is something that has had a significant impact on a lot of my followers. So akathisia is a movement disorder that's characterized by a really intense sense of internal restlessness and a compelling urge to move, which is just out of the person's control. Now, this can look a lot of different ways. It could look like pacing, shuffling, rocking, shaking, fidgeting, and just being unable to stay still. Or it could be a more internal sense of restlessness. So it might be just feeling really on edge or like you're about to crawl out of your skin. People have described it as chemical torture before. And especially that internal kind of akathisia can be really hard to identify. People might just assume that this is anxiety. And that's a common misdiagnosis, but let's get to that later. So what causes akathisia? So we typically think of akathisia as being a medication-induced movement disorder. And we normally associate this with antipsychotics. So some of the worst offenders are going to be things like aripiprazole, otherwise known as Abilify, as well as lorazepam, otherwise known as Latuda. However, akathisia can occur with a number of different psychotropic medications. So this can include things like SSRIs or antidepressants, sleep aids, mood stabilizers. There are also some medical conditions that can lead to akathisia. So sometimes this can occur with Parkinson's disease, or it can occur when there is an iron deficiency. So if someone is coming to you with symptoms of akathisia, then first look at their medication list, second check their ferritin, and screen them for Parkinson's if that's a concern. Why is it important that we talk about this? It's because this can be a potentially deadly condition because it is so difficult for the person to cope. The other thing to keep in mind is that akathisia can also occur as part of a withdrawal syndrome from different medications. So that could be an SSRI, it could be an antipsychotic, a mood stabilizer, a sleep medication. And these types of situations are really challenging because you can't just lower the dose of the medication or change the medication. It's just that their body is reacting to the withdrawal of the medication. Sometimes you can reinstate the medication, but sometimes that can make it worse. So how do we manage these symptoms? Well, that's where it can be really challenging. So as far as non-medication interventions, certainly exercise therapy, allowing yourself to pace, engaging in regular exercise can be one way to cope. And also just reassurance that this will get better with time, even though it feels like there's no escape in the moment. Most people do recover from this condition. In terms of medications, there are a few different medications that can be used to treat akathisia. So things like benzodiazepines, propranolol, which is a blood pressure medication, and sometimes other antidepressants like mirtazapine can be helpful. However, if the akathisia is part of a withdrawal syndrome, then it's really important to be cautious with this because one, some of these medications can cause dependence and withdrawal issues in and of themselves. And two, sometimes these medications, because they're CNS active medications, can actually make things worse. Why does akathisia matter so much? It's because this condition can be really potentially dangerous because those who are in the midst of it, it feels like there's no escape, and suicidal thoughts and suicide attempts are not uncommon. So it's crucial that we are aware of akathisia and that it's properly diagnosed, because I can't tell you how many times a patient has come into an office complaining of anxiety, restlessness, and it's misdiagnosed as anxiety or agitation, and then their SSRI is increased or their antipsychotic is increased. But guess what? It just makes this worse. If you've had an experience with akathisia and there's been something that's been helpful to you, then please share that in the comments below. I think a lot of people could benefit from that. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.